Finally, let's talk about drug therapy for hypertension. Before discussing drug therapy for hypertension, I'd like to talk about prevention, which is actually more important than treatment. This is because hypertension often has no obvious symptoms in its early stages, and once complications arise, it has often already entered an irreversible stage. Hypertension cannot be cured at present, it can only be controlled. Once diagnosed with hypertension, long-term treatment, monitoring, and medication are required. This can be very tiring and costly, so prevention is extremely important. In fact, there are many common diseases such as cardiovascular diseases, hypertension, hyperlipidemia, hyperglycemia, many gynecological and pediatric conditions, infectious diseases, and even a significant portion of cancer cases. Most of these diseases are related to lifestyle and environmental factors, and their risk can be reduced through lifestyle interventions. With proper lifestyle interventions, it is possible to completely avoid these diseases or delay their onset. Now, let's take a look at the prevention of hypertension. The prevention of hypertension primarily involves lifestyle adjustments, which I have discussed extensively earlier. Let me summarize the main aspects of hypertension prevention. 1. Healthy diet. Reduce salt intake, minimize processed foods, and increase consumption of vegetables, fruits, and whole grains. 2. Regular exercise. Exercise benefits heart, lung, and vascular health. Engage in moderate-intensity aerobic exercises such as brisk walking, running, or swimming. You don't need to work out every day. Many people think that exercise must be done daily, but this is not the case. Our muscles, cardiovascular system, and nervous system need time to recover after exercise. Overdoing it with high-intensity workouts every day can lead to overexertion and harm your body. Aim for 3 sessions of moderate-intensity physical activity per week, each lasting 30 to 60 minutes, to maintain good health. Next, lose weight. If you are overweight or obese, weight loss is essential. Losing weight can effectively lower blood pressure. Quitting smoking and drinking. Smoking significantly increases the risk of hypertension, so smokers must quit. As for alcohol, many people claim that moderate drinking is harmless or even beneficial for health, such as drinking red wine. However, authoritative medical research institutions have refuted these claims. Alcohol is definitely harmful to the body, and moderate drinking is not entirely harmless. It simply carries a lower risk. Another aspect of blood pressure prevention is stress reduction. Stress, especially chronic stress, can affect blood pressure. When you feel stressed, especially under prolonged stress, you should find ways to remove yourself from that situation and relax through exercise, deep breathing, meditation, or other methods. Lastly, reduce exposure to environmental pollution. Environmental pollution also significantly impacts blood pressure, especially air pollution such as smog, which contains numerous tiny particles. Inhaling these particles can trigger systemic inflammatory responses, stimulate the sympathetic nervous system, causing vasoconstriction and elevated blood pressure. Noise pollution, water pollution, and indoor pollution can also lead to increased blood pressure. Therefore, if you are in a polluted environment, you should find ways to avoid it.